One of the things that I've experienced over the last year and a half is getting to know Christy Phillips. And many of you who helped us with the project that you're going to hear about in a few minutes also. She's wonderfully, just a splendid personality and kept us all organized and ready to go. So let's give Christy one more hand. I won't be up here very long because I think there are a couple people that you'd love to hear from much more than I. But I do want to take this opportunity to share with you just a couple thoughts about why we're all here. First of all, we're here just in celebration of the work that we've all and the input that we've all contributed to this project. Many of you, were hands-on, and we appreciate that. And we're going to hear about what we found over the last year and how in just a few minutes. But I was telling Linda a little bit earlier, when you have been in this community all your life like I have and served in some of the roles that I have, a lot of what you're going to hear from me is not new information. Disparities, issues with equity, issue with navigation, issues with some of the social and economic problems that exist in our community. And in my work and effort around the NAACP, I'm in these kind of conversations every single day. It's a shame that it took the pandemic to expose some of this or to make people more aware of what many of us have known and experienced for many, many years. All of that to say this: we've come a long way in a year and a half. We need to celebrate the partnership and the collaboration that we've seen, but that ought to also send a message to every one of us. Let's keep holding each other's hands. Let's keep marching in the right direction to eliminate those disparities, those inequities. Let's lift everyone as we lift this community. Thank you.
Okay, now to give you the final report summary, we have Dr. Pam Ross McLean.
Well, good evening, everyone. Thank you for being here with us. It seems hard to believe that just over a year ago, I was sitting in Jack's Meat Market parking lot, and along walks Evelyn, and I'm thinking, ooh, I love her haircut, And we had a chance to talk, and she said, we just applied for a grant, and if we get it, I sure would love for you to help me out with this project. And so fast forward, more than a year later, we sit here at the culmination of a lot of collaborative thinking and engaging with one another with a final report that is actually complete and in draft form. And I just think I'm so proud of what we accomplished together as a team, as a collective of stakeholders. And so what I'm going to do is basically tell you a little bit about our journey, share a snapshot of what we learned as a result of our study, and then talk to you a little bit about the recommendations that we have at this time and what we perceive to be the next leg of this, should we be awarded another grant to try to fashion a change implementation plan for how to address some of the things that we unearthed during the grant process. So, with that, we were funded by the Michigan Health Endowment Fund. And what I'll say about them is that they took a bold and new approach to thinking about how you help to heal communities, how you help to come up with viable solutions to the persistent problems that plague communities, not just ours, but others across the nation. And so they decided that rather than give the money to university people, to researchers who can come in and do research on us, that they would give the money to us so that we could actually study ourselves and figure out what are the barriers that are causing these racial disparities in behavioral health follow-up care. Now, let me just say this. I am a university professor, right? Or I used to be. I have a new job now. But most of my career, I've been a university professor. And it's not that there's not room for all types of researchers, but sometimes academics can become so heady that what they're trying to convey is lost to the masses. And so we've got to be able to change that. And so I'm very excited that people like the Michigan Health Endowment Fund are investing in basically community-based participatory research. So we set out and we had an objective, right? Now, it may seem easy to you to come up with an objective, but when you have about 30 brilliant people in a room, it's hard to figure out what you're going to target on, because we wanted to address all the problems in the world, but we landed on, we were going to learn about the lived experiences of African American behavioral health care clients, and we wanted to establish an understanding of their experience, of the barriers experienced by African American behavioral health care clients that inhibited their follow-up care. So that's what we set out to do. We decided that we were only going to speak with adults who had had lived experience in Saginaw County within the past 5 years. We also decided that we were going to have a few ways to collect data. We were going to have one-on-one interviews, we were going to also have listening sessions, and we were going to administer a county-wide survey. The last thing that we did that helped us was we did a data dive discussion. Because when we started out on this journey, we were in a very fortunate position because our funder basically said, we already know that there are racial disparities in Saginaw County, and they mapped out that those disparities were most prevalent in the African American community. Well, when we were sitting in our room, some people said, that's not what our local data is saying. That seems a little bit odd to us. So we took that as an opportunity to look at other data sources to determine whether or not the premise that we started with was in fact accurate. All that being said, we set out after going through some team trainings, and we started our interviews and our listening sessions, and our survey was designed and disseminated. And what we found was that there were several things that basically emerged from the qualitative data that our participants shared with us that were barriers that impacted their ability to follow through with care. One of those barriers was the complexity of the behavioral health care system. Another was a poor treatment experience, cultural mismatch with providers, social stigmatization, inconsistent providers or access challenges, mistrust issues, overuse of prescription drugs, communication challenges, religious beliefs, and self-accountability. So in a nutshell, these are the things that we found. And while we weren't required to do an expansive review of the literature, there is nothing that we found here that is not also substantiated in the academic researcher that scholars have done to try to figure out where the barriers are. So now I'm going to share just an overview of some of the raw data that emerged from our study. What you will actually read when you read our final report is you'll see us discuss each of the barriers we found and then provide you with the evidence in the words of our participants. And so our team basically had to go through hundreds of pages of transcripts and pull out the passages that coalesce to substantiate the themes that I just shared with you. So the first one is complexity of the behavioral health care system. And what we found is that a lot of people, this particular person's words were, all they pretty much did was just give me a piece of paper with contact information to all of them mental health numbers that you can call, and then you basically just make an appointment and go through the system, right? So this person is really trying to describe how they kind of just felt shuffled through this system. And this was probably one of the most dominant themes that emerged, is that people just really had a hard time navigating the behavioral health care system to get what they needed to be healthy. We also had several people talk about their poor treatment experience. And so I won't read this entire quote, but the very last line sums it up. They were terrible. Now, I will like to add this. If you ask people what is wrong with something, they're not as inclined to tell you what is right with that something. And I will say one of the things that we also found were that there were people who talked about really positive experiences that they had. They talked about not feeling like a number and running into providers who went that extra mile for them. So the things that you'll hear from us are by and large seemingly negative on the surface because we were asking them specifically to talk about the barriers. But there were several people that described really poor treatment experiences. Another theme was cultural mismatch with providers. And this came up time and time again, and I'll just say it in shorthand. A lot of people felt like their providers had a hard time relating to them because they didn't share their cultural identity. They didn't understand their lived experiences. And so this person says, and if you have someone of your background, they may be able to relate to you and know where you're coming from compared to someone that's not. And what I think is really insightful about this is that they said they may be able to, right? Because looking alike on the surface doesn't assure that you have the same lived experiences, but it's more likely the case than not. And so I'm going to talk a little bit later about some of the things that we think we can do to address this cultural mismatch, because unfortunately, like many of the other helping professions, we just don't have enough people of color entering into the professions. So social stigmatization was another theme that emerged. And what we thought that was interesting about this is that respondents were very aware of how they were seen by the general public, or how they were seen by their family, or folk who just didn't understand their experience. And this person said, they just thought I was a troubled child. They didn't talk about mental health. There was a stigma, right? And so we're hopeful that we will begin to be able to destigmatize what it means to have mental illness or substance use disorder. Another barrier that came to the surface was inconsistent providers or access challenges. And so folks felt strongly that the nature of receiving care was very intimate, and if they weren't able to be assured that they were going to have the same provider, it felt like the minute that they were getting some momentum or building a relationship, they were perhaps presented with someone else. And so this person says it just became expensive, and it became bouncing around from one therapist to the next therapist because they were moving on or going somewhere else. And that was said in any number of ways across our data. Mistrust issues. This person says in short, I didn't trust none of them. And that's unfortunate, but what you'll find is that not trusting the medical profession in the African American community is not uncommon, and for lots of historical reasons, but we clearly saw that our participants were not always sure that the people in charge of their care could be trusted or had their best interests in mind. Many of them felt like as they were disclosing things about their life, it ended up causing them to lose their kids, causing them to have all kinds of other challenges. So this was a really sensitive area for our participants. Overuse of prescription drugs. This, time and time again, now there were some outliers where occasionally one of our participants might say they knew what they needed and they should just give them their drugs and let them go on their way. But by and large, most felt that the go-to was giving them a pill too fast and that they weren't really digging deep enough, hearing them out, talking about how the medication made them feel. This person says, people like to talk sometime. You can't just don't keep throwing meds at me. And over in our data, people felt like that they were just being over-prescribed drugs rather than treated. Communication challenges. Many of our participants felt like they were talked at and not talked to. They also felt like they weren't being heard when they were trying to communicate their perspectives. This person says, sometimes there was a lack of communication between the patient and the doctor. I didn't think I had a chance to speak with the doctor about my health concerns enough. I didn't see him as often as I should. All right, so the last couple of ones that we found were particularly interesting because while we thought they might exist, and I didn't say that before, when we were coding our data, we went in with a priori coding method, meaning we had an idea from the literature, from our professional experience, what might emerge from the data, so we used that as a guide. But interesting, religious beliefs became a barrier because a lot of people in the African American community believe that prayer will cure everything. And I actually believe that too. But in some cases, you need more than prayer. And so what we found is that a lot of our participants, because of the mistrust that they had with this system, because of the poor treatment experience that they had, that they actually relied on their faith to help heal them. And this person says, when I started pursuing that for myself, started reading the Bible and implementing the scriptures, I really started changing. And I didn't have no counselor, no therapist, no nothing. And that was said any number of times across the data. What's interesting though about that, and I can't cite the research, so I'm just going to paraphrase a little bit, but in a lot of the medical research, they show that treatment coupled with faith gets better results than people without faith who just receive treatment. So there is this notion of the power of belief. The last theme that emerged from our data was self-accountability. And what we thought was really interesting about this is that while we were asking people about barriers and we sensed that they might have experienced them, some of them said that they were the barrier. This person said, well, it wasn't barriers because I look way beyond that, but what stopped me probably was myself. I don't let no one else fix and pass my life, so I blame it all on me. And that came up enough that we thought it was a theme worth mentioning. So, the next stage for us, per our funders expectations is that we take what we found and we make recommendations for what we can do about the things that we found to improve the situation. And so we made several recommendations. One of them is community partnerships. We really believe that community-based organizations should be essential partners in work that is steeped in improving the quality of life in communities. We hope that this momentum that we got to experience through this project will continue, and I believe it is, because I've noticed that universities and other institutions are really aggressively pursuing authentic partnerships and collaborations with community-based organizations, faith-based organizations, you name it. We need to be connected to our communities. Another recommendation is the provision of cultural competency training, because it would be wonderful if we were going to get an onslaught of providers of color or clinicians of color. In the absence of that, everyone needs to be culturally competent. You need to know how to serve people who may not share your cultural identity. So we also would like an education campaign, because if we're smarter, when you know, as the old expression goes, when you know better, you can do better, all right? So we would like to have an education campaign that can take some of that stigma away that often is an impediment to people seeking care. We also believe that there are policy reform that may need to happen, whether that's local policy or national policy, but sometimes people don't get help they need because they get caught up in the red tape of policy-driven bureaucracy. We also think that community-based participatory research is something that should just be second nature, right? That we really should be studying our own problems. Very often we love imported genius. We love to bring people from other places to come tell us how to fix our problems. And who better than us to be engaged in finding solutions that are right-fitted to our community, all right? We also said we need sponsored community conversations. We need to get together in spaces like this and talk to each other, you know? And that's not a hard thing to do. We also need consumer advocacy, meaning those folks who are having a hard time already because they're plagued with substance misuse disorder or mental illness, they need people who may have their lived experience or may have expertise that can help advocate for them and help them navigate the system. Yes, we want the system to change, but until it changes, we need people who can be in there advocating, supporting, and helping folks to be successful in receiving the full extent of care that they need. We also thought that wellness and prevention would be something that would be beneficial. Workforce development, we need to do some things to attract folks to the professions. I can tell you this, you can grow anything you're willing to pay for. And so when we start talking about we don't have enough people in the health professions, we don't have enough people in education, I'm now working at Delta College, and people are approaching us now saying, how can you work with us? We are willing to pay for people to go to school because that's how desperate we're in need of teachers and therapists and counselors. And those kinds of things incentivize folks wanting to go in professions. You spend a lot of money to not make a lot of money. Therefore, it's helpful if people have invested in you along the way. So, and then lastly, we don't want to underscore provider diversification. We discovered that, you know, our participants who had an opportunity to have an experience with a provider that was African American, they valued that, they appreciated that, but they said it was rare. And so we are hopeful that when we do have providers of color, that they are utilized and that we are aggressively seeking ways to continue to diversify the provider pool. All right, so now last couple of things. Our funder asked us, so what do you all think you want to do now that you've found out all of this stuff? What can you do to make a difference? And we actually came up with a project. We're still fleshing out the details. It'll be titled the Community Resilience Project. And we originally came up with 9 interrelated components that we wanted to implement. And they asked us to narrow it down to 4. And the 4 components that they liked were the community review panel, where we can actually get community representatives to be cultural informants who will then be able to help us think about things that we need to do at the local level, and with our providers' help to rethink the way in which we provide care to our community. We also are going to be positioned to provide some culturally responsive practices training so that it'll be free to the public, and people who want to get that training, it will be provided for them. Communicating recovery perspectives. We are going to use the Women of Color's TV network to continue to tell the stories of our participants. We really had people that opened up their lives to us in these interviews, and there is so much more that they can tell us when we amplify their voices and share their stories. That just really goes a long way, because you have no idea what people have been through in their lives until they tell you that. So that's one component. And then the last component is the care recruitment / proponents. We're trying to be clever and have all these CRPs so that it would look like it had continuity, but essentially this last one is we are going to be hiring and training advocates so that when people say that the system is complex, there are folks that they can call that can help them navigate the system, that can help them get access to transportation, that can help them connect with the resources that they may or may not know are available to them. So all of that together is our project and what we've been up to in a nutshell. It has been a powerful learning experience, and we are hopeful that we'll be able to continue this journey in phase 2. We could not have done it without all of the stakeholders who were committed to this process and partnering with us. So thank you all very much.
Hello, everyone. I'm Evelyn McGovern, the president of Women of Colors and also the co-founder. And I'm excited to introduce our guest speaker, Mr. Albert Gay. And I've never met him personally until today in person. But I heard him. I heard him a year ago in September at a Mid-State Health Network conference. And I've never been to attended a conference, and this was online, this was Zoom, but he was the last class that I attended at that conference, or during that conference, and he was so energizing, so motivating. And when Christy and we were talking about, well, who can we get to come speak at our event? And first thing, when I said Albert Gay, Christy jumped, and we were just so excited. So you're in for a treat. And so I just want to read a little bit of his bio. Albert Gay, master social worker, has over 20 years of experience in community work. Albert began as a youth pastor in a local church in Gary, Indiana. Since that time, he has continued to influence communities with prevention services through his various roles as youth serving agencies, nonprofit organizations, and coalitions. This desire to positively impact the lives and health of people transitioned him into the role of a trainer, where he came across many diverse groups that sought the same end goal. Over the years, Albert has held training positions with the Indiana Association of Prevention Professionals, Center for the Application of Prevention and Technology, Minnesota Institute of Public Health, She-Ray and Associates, LLC, and TTJ Group, LLC, as master trainer and as a consultant at both state and national levels. In those capacities, he has worked with African Americans, Hispanics, Native Americans, military, faith-based, LGBT, rural, and urban populations to build capacity around substance abuse and HIV prevention. Currently, Albert is the Education and Training Specialist and Research Associate at Indiana University, Indiana Prevention Resource Center, which is within the School of Public Health. His area of training, research, and development are mainly concentrated on substance abuse prevention, strategic planning, and coalition organizational development. His other areas of interest include mental health, societal and health disparities, social justice, cultural competence, historical trauma, and faith-based initiatives. Ladies and gentlemen, I want to introduce Mr. Albert Gay.
Hey, good evening, Saginaw. Good to be here. How's my voice over this mic? Good. I got a quick question. How many of you all really appreciate women of colors? Let's give them a huge round of applause. I am so grateful to be here, and thank you to Evelyn for thinking about me a whole year later. I didn't know I had that type of sticking power, so I'm glad to be here, and I'm so thankful to all of the women of colors who have said, yes, let's put a rubber stamp on that and let's get him here. So I'm glad to be here. Thank you all very much. So we're here for a good long time. I understand I got 3 hours. No? 30 minutes, huh? All right, I'm gonna look at my clock and try not to keep y'all too late. What time are we ending? Midnight? So I've been listening and learning and hearing what's going on in your community, and I'm so thankful for the work that's being done, not only through your volunteers and those that are on staff, but also to the community members that have also played a part. So give yourselves a round of applause if you've in any way supported women of colors over the duration of years in which they've been here actively moving and trying to make that difference. We're going to talk about blue sky outcomes. When I say blue sky, I want to talk about limitless possibilities and what are those things that you see for Saginaw's future. Just kind of shout them out to me. What do you want to see here for your community and your people that you love, that you see every day? What are some things and some goals and some vision that you would want them to reach? More jobs. A thriving downtown. I like that. What else? More restaurants and affordable housing. I love it. What else? A grocery store. We got the Amen corner over here. I like it. Medical access and especially psychiatric. Thank you. How many of y'all could feel that when he put it forward? That the way you stated that and the way we talked about with the grocery stores lets me know there's been a tremendous deficit. How many of y'all have lived in deficit communities all your lives? I'm from Gary, Indiana. I don't know if you know the reputation of Gary, but I want you to know Gary has a story. And if if we hang in there with each other, we might realize just how common our deficits are and how we might also be able to strategically overcome them. So we're going to talk about how do we reach those blue sky outcomes that you just talked about, right? And so how many of you all are familiar with the 8 dimensions of wellness? 8 dimensions of wellness. I saw a few hands. Yeah. This is something that comes down through, there are several researchers and organizations as well as associations that agree with this. One of them is SAMHSA, the federal government's Substance Abuse and Mental Health Services Administration. And so they help to fund a lot of behavioral health grantees to help bring about wellness, what I'm dubbing as blue skies, to our communities. And so in order to do that, there are 8 dimensions, and I want to see which of these 8 dimensions. What they say is that we should look for a balance amongst all of these. Starting up here with emotional. Coping effectively with life and creating satisfying relationships. How's that sound, everybody? That sound like something we want to reach towards? Financial. Any grins right now? How important is financial to wellness? What do you think? What do you think? I see your head nod like, yeah, that's absolutely important. It's absolutely important. Wealth be a part of that pursuit. And that is satisfaction with current and future financial situations. Social. We got developing a sense of connection, belonging, and well-developed support systems. So when I ask your blue sky, and you're saying things that are missing, that are supportive, that's already telling me that this 8 dimensions of wellness societally here for a group of people may not be as balanced as we want. Is that fair? All right, let's keep going. Spiritual. Oh, I love when you put up there, Doctor, about people and their connection with religion and faith and believing. And look out, it's up here in the 8 dimensions of wellness. And what it says is expanding our sense of purpose and meaning in life. Does everybody know their calling in this room? Anybody still trying to figure it out? I hope all of us are still trying to. Anybody achieve their spiritual height? Go ahead and raise your hands and just walk on out of here. Matter of fact, just float on out of here if you have achieved that. Otherwise, we are all in pursuit of that, right? Look at this next one. I think I heard somebody say this during Blue Sky Time. Occupational. Personal satisfaction and enriched enrichment derived from one's work. How many of you all have the perfect balance with that? The absolute perfect balance. All right, the other ones of us, how many of y'all overworked? All my overworked people, raise your hands. Let me see you. There we go. There we go. Being overworked expands that area, that dimension, and it means that other areas end up becoming deflated. So keep that in mind. And I heard something about jobs. We want jobs, but we don't want just any kind of job, do we? What kind of jobs do we want? Yeah, we want the right type. We want the type that I don't feel stressed about when I go to work. I feel appreciated, and that motivates me to work even more, but in a way in which is balanced with the other things of life that I have to deal with, right? Physical, recognizing the need for physical activity such as diet, sleep, and nutrition. Do you all know that your occupation can impact that physical? It can impact it positively or negatively. What's a way in which your occupation can positively impact your physical? What's a way? Overworked can definitely positively or negatively impact physical. Negatively, absolutely it can. How many of y'all miss sleep sometimes? Got some paperwork turned in, got a report that's 80 pages. It's due tomorrow. Got to stay up again, right? Name a positive way in which that physical can be impacted by occupational. Keeps you busy? Food on the table, absolutely it does. Yes, sir. Absolutely. There's a mental and emotional reward when you feel good about helping somebody in your occupation. How many of you all have jobs like that, where you feel good afterwards? It might even be hard, but it's that good kind of hard. You're satisfied. You're like, yeah, I worked hard to help this person and their status in life. I'll do it again any day. My mom was a teacher for over 53 years. Yeah, started out in Missouri, ended up in Gary, and worked the next 48 years there. And worked, listen, when I say worked, she not only worked at school, she worked when she came home, she worked summertime. She would have, get this, y'all, during my summer vacation, she'd have kids at the house where she was giving free tutoring services, and them parents were more than happy to drop those kids off during the summertime and pack that house. That living room had card tables up everywhere. Except it wasn't any games, it was all work. But she felt so satisfied. So thank you for saying that. Intellectual, recognizing your creative abilities and finding ways to expand knowledge and skills. Do we have those opportunities here in Saginaw where people can stretch out and expand into their limitless possibility for the very gifts and talents that they believe they have? Do we have that here? I'm hearing some mixed reviews. I'm hearing kind of, maybe, sort of, no. Right? So keep that in mind, because that's part of your health outcomes and your behaviors. Environmental, this is one of my favorites. Good health by occupying pleasant, stimulating environments that support well-being. How are we doing here? Do we have that? I'm hearing a silence and a no. But this isn't just our outdoor environment. This is how we do in our what? In our homes, in our schools, in our jobs. We want to work to create that. And then we ended those. And what it says basically is this: if we can achieve balance and maintain balance in all of these areas, then we'll be like a smooth wheel. Anybody grow up back in the day riding on a 10-speed bike? Any 10-speed bike riders from back in the day? Excellent. Do you remember going so fast and you hit a curb and then you grew that knot on that? You grew that, after you tumbled over and got back up and you tried to ride that bike back and it had a knot on it. Anybody ever have a knot on that wheel? How was that ride going back? Was it smooth? No, it was very shaky and wobbly. A lot of our communities are shaky and wobbly because we've got areas where we're overinflated and areas where we're depleted, and we need life in those areas. And we got to work, y'all. We got to work with women of colors. We got to work and find partnerships so that this 8 wheels not only exists in every dimension, but is balanced for all of us. And we're going to talk about how, because that's how we reach our what? Our potential and our blue sky. All right? So we're going to reach it, and those outcomes, when we reach them, oh, there's a little thing that's supposed to happen there, but different computer. But while we're on Earth, before we reach blue sky, let's start with where we are. How many of you all know that Women of Colors does prevention programming? Prevention. What does prevention mean? Any of you all that raised your hands. What's prevention mean? Everything? Okay, I like that. Protecting the things that you value. So let's show how we do prevention. How many of you all have ever had babies, toddlers in your house? And what do you do with the little electric outlets? What do? You cover them up. That's called prevention, and you're protecting something that you what? Highly value. We protect our babies. Instinctively, we begin to know, hey, where might that baby go? How can I provide protection while that baby is here at this ground level, right? Back in the day, my mom and dad had a baby fence. Anybody have baby fences? We had a basement with a lot of stairs. And that baby fence was stretched across so that I couldn't go down those stairs. But you know what? As you grow up, that baby fence isn't enough, is it? Sometimes old Albert finds a way to climb over that baby fence and ends up head first inside of a tire at the bottom of the stairs. So how can we continue to provide protection the way that women of colors has been doing, and then increase it to a level so that it's not just women of colors in the volunteer base, but it begins to multiply through the multiple partnerships that we have represented here at this table? How many of us want to do that? Protect the babies that we highly value. Babies is one thing, but we also value others in our community, don't we? Who else might we value here? Just shout it out to me. Seniors. Students, absolutely. Veterans, thank you. Any former military members like myself here? All right, thank you. Thank you for your service. Oh, Evelyn, you as well. Thank you for your service. I knew it. We had a connection. Excellent. Who else do we value here? Nurses. Military workers. Yeah, absolutely. Thank you for acknowledging those that serve the United States in other positions other than just being those that are signed up as soldiers. Who else? Lawyers. I like it. Yeah, we definitely want to protect them. We value them, right? So here we go. I want to talk about this because as we are down here before we get to our outcomes, our blue sky, we got some work to do. Because if you notice, is it going to be easy for this budding plant? Why is it not easy for this budding plant?
It has to grow. It has to be
It needs to grow. It needs water. It's got roots, right? Is that a proper environment right there for that plant? Concrete will restrict it. Restrict its growth. So what we're essentially saying here, if we wanted this plant to grow as tall as a tree and touch the sky, we got to first think about the environment in which it's growing up in, right? What are the barriers? How many of you all can see barriers right now for young people, elders, veterans in our community today? You can see the obstructions. So we got some head nods and some hand waves. I want us to remember that this plant will only grow as tall as its roots are allowed to expand in its environment. So how's our environment, Saginaw? How's our environment? Our outcomes that we currently have can tell us what? If the roots are allowed to grow deep. What do I mean by that? Okay, somebody tell me how our school system is doing, because we care for children, right? How's our school system doing, you all? It could do a lot better, right? How do we know it could do a lot better? What kind of data do we have that shows that the roots are not going deep? So So teachers need to know, have a stronger base so that they can teach more. I like that. What are some other data outcomes that you can accumulate to tell how much our roots are? International comparisons. I love it. Absolutely. Now you sound like you got a lot of experience, right? There is data for everything she just said. That survey that was presented reflected the adults, and that's the same type of survey we can have that children can tell you how they feel when they're inside of school. Now, I do some work called Interrupting Racism for Children. I do that for adults that work with children. We do that throughout Indiana. I come down, I do trainings. We work with the police, several police departments, several schools, and then we started doing it with children in their age groups. Ready for this? There's nothing worse than hearing babies share their experience in school that you remember yourself having 20, 30, 40 years ago. Modernized and updated, but it always equals the same. I feel bad because I'm being rejected based off characteristics and the way I look. The teacher made me turn over they call it flipping the card. The teacher made me flip over my card even when I didn't do anything wrong. Flipping over the card was a behavioral program strategy that if you were doing good, it stayed green. And everybody sees that you're doing well. And if a teacher tells you to flip it, it means that you are doing bad. And if everybody around you is green, and you are the only brown, black face in there, and you keep getting told, turn your card over, Jerome. Babies telling us experiences in the modern day. Now, there's more to that story, so I'm going to keep going because I want to share this. We had already admitted that if our environment and our children are growing up in these areas and circumstances where they're not having enough, that creates something in the family called ACEs. How many of y'all are familiar with ACEs? ACEs stands for what? Absolutely, I love it. That lets me know exactly where you are, all trained up in adverse childhood experiences. Lets me know that you have some background because I'm going to connect the dots. That was a study that was done in California. It was majority with white middle-aged men who were of success in the 90s. And that study came as a result of physicians trying to figure out why adults couldn't break their bad habits, even if it meant further hospitalization or the occurrence of disease coming down the line. And so they were like, if we could just figure out why these adults are still having these negative outcomes. And so one day, they started doing surveys. And they started doing surveys, and in the survey, they would ask, hey, when was your first sexual experience? So doctors wanted to know that. And this one particular case, the lady said this, and it turned the light bulb on. The lady said, willing sex or not? Something that the physician, who was also a white male, had never thought of. And he goes, And so the lady told her story And it went back to trauma. And then the doctor got together with the other physician that was also in the research, and they said, hey, maybe we've overlooked something. Maybe the missing ingredient has been trauma. So they re-interviewed those patients who kept reverting back to negative behaviors. And guess what they found? They found trauma in childhood. And that's how the ACEs study began. And what that means is for those of all us that aren't familiar, is that if a child has 10 or more, or 10 or less, there are 10 questions, and if a child has one or more of these 10 areas, that person, the more they have, the more likely it is for behavioral health problems in the future. Those things were domestic violence. Did those children witness that? Substance misuse by parents, emotional or sexual abuse. Did they witness watching their mother being mistreated, and specifically the mother being mistreated? Was there physical or emotional neglect? Was there divorce? Was there mental illness, incarceration, or homelessness? And those things, if there was an answer of yes, then it means that there was something called toxic stress that would impact that person's life even into their adult years, no matter what age of adolescence or childhood they experienced it. Now, when I heard that, I was like, oh my goodness, who doesn't have toxic stress in their lives? And here's what it meant. If you had it, especially those that had 4 or more, you were 15 times more likely to engage in a substance misuse known as opioid use. Anybody heard about the opioid epidemic lately? And it also leads to other diseases down the line if we don't go back and address this trauma. So here's what we've been doing. In a Band-Aid world, we've been running to these traumatized adults who are little less or really traumatized children, and we've been approaching them not realizing that those trauma-filled homes and those things like sexual assault, physical neglect, divorce, that too has a root in something. And that has a root in our society. And if our society has had poverty, discrimination, community disruption, lack of economic wealth, poor housing, and violence, some of the things we mentioned we wanted in our blue sky, that we wanted housing, right? If we lack those things, guess what type of stress is coming into those homes? And guess what the resulting fruit is and branches as a result of what toxicity is in the soil? And then we come and run to cure this toxicity with the Band-Aid. Anybody got a Band-Aid in your pocket? Anybody? I love women of colors because they are willing to dive deep beyond surface level programming. Well, we just gonna do this and that'll help the kids. How about just an after school program that doesn't do anything more than just talk about substance misuse? They care and value enough to go, hey, we gotta get some data. We gotta dive deeper to find out what's producing this stress and these behaviors, so that these children have a chance to reach blue sky as opposed to shorten out when they're babies. I'll tell you another thing that I never want to hear in my life again. We've been doing that program with these babies. And you know what, these babies, they open up quick, y'all. Don't ever be intimidated by young people walking around with a front on, right? Because remember, you used to be that young kid with a front on, right? They open up quick. You know what they tell us? We had one kid tell us, 13 years old, he said, we just wanted to get together. We hung out with my friends, played football. He said, but the teachers kept saying when we were hanging out that we were a gang. Who kept saying it? Teachers. It kept labeling black boys that just wanted to hang out together as gangs. You know what that kid told me? Told all of us in the room. He said, since they kept saying we're a gang, somebody tell me what they did. They became a gang. You know that's research-based, right? They said teachers that have low expectations, their children will perform to the lowest of those expectations. That's research. If teachers come in with high expectations in communities, it says those same children will come out with what? High expectations, and they will reach the sky. Blue sky, y'all. So you ever heard that thing about children are the future? Erase all that. It's not the children are the future. It's our expectations of our children, which is the future, which is why we need to celebrate women of colors, because they're out there on the grind making sure that our children, what? Reach high expectations. They hold them accountable. They also hold our organizations accountable by collecting data. Every time you collect data, you're holding them accountable. Here's the thing I didn't want to hear babies say anymore. If you hear children say this in your community or have heard it, I want you to let me know. So we're teaching about racism and how that had an impact on their lives. And before we really get into it good, we allow them to open up and share things about themselves and their aspirations. You know what we hear multiple times? I just want to break the generational curse that's on my family. Anybody heard that before? If that doesn't make you sick, I don't know what will. Because the context behind that is that babies are growing up thinking, this ground here, this life here in my house so toxic, this community I live in so toxic, that I don't know how to word it or phrase it other than God is against me and cursed us for generations. Generational curse. When they don't understand how this society played a part based off of their race and ethnicity to impact them over the long haul. So here's what y'all been doing. Kids have been screaming out, help me grow. Help me grow. That means we have to begin to even further go beyond what it is that we've been doing. Hey, I've been mentoring children. I've been helping Little League. Great. You know what we got to do now? We got to go next level. Next level is public health. Public health is what we as a society do collectively to assure the conditions for people to be healthy. What we do collectively to assure the conditions for people to be healthy. What are those conditions? Right here. Discrimination, facing it head on. Poverty, facing it head on. Poor housing, so that we understand it's not that the children are the future, but we who help their roots grow becomes the future. If we continue to have children that are born in this, then the majority of them collectively do not rise to their full potential. So thank God for women of colors, because what are they doing? That data that they found is the first steps towards more action based off of the discovery of what that data said. So if people feel, check this out, y'all. If adults feel when they go in for services that they're rejected, that people don't want to spend time talking to them, if we don't move that, by the time those children grow up and navigate those same systems, it'll be the same thing, and then they'll pass it on that I must be being rejected because God is against me. How many of y'all want to do God's work? Then let's correct that so that those words never come out of the mouth of babes. We can help them reach the sky with something called the social development strategy. I like this. I'm going to explain this from bottom to top to bottom. We want to reach blue skies, right? We want our youth to do that. The goal is to have healthy behaviors for all children. How many of y'all want healthy behaviors for all children? That includes their behavioral health, whether they make decisions to use drugs, join gangs, participate in violence, drop out of school, or whether they go on to careers, college, get the fullest self-awareness that they can in all the gifts that God has given them. And the way to do that is to start with healthy beliefs and clear standards that the adults have. And if adults have healthy beliefs and clear standards, and when children come with their already protective factors of what's called pro-social ideas and their intelligence and resiliency, when they are provided opportunities, provided skills when they are in those opportunities, and provided meaningful recognition, those children will bond with whomever gave them opportunities, whomever provided them skills, and whoever said, hey, good job on that, or wait a minute, you can do a little better. I want you to go back and do it again. They will bond, and in that bonding, which is the biggest protective factor ever, it says they will exchange those healthy beliefs and clear standards. They will adopt them from whomever provides them opportunity. I want to show of a quick hand. How many of you all have ever provided opportunities for young people here in this city or in this community? If you've done that and then helped provide them skills and recognition, give yourselves a round of applause, because that is something that you may not know it, but they adopted something from you. And well past their time being away from you, they will continue to go towards those healthy behaviors. How many of you all, for you all, that was kind of random? You did that randomly. It wasn't anything structured. This particular child or youth may have been within your family, or maybe it was just somebody you took a liking to, right? What we with Women of Colors can do is make that a structure so that it's not random, so that the majority of children coming out get those same opportunities and skills, get pointed in the right direction, and come out on the other side as better people in their 8 dimensions of wellness. Now, here's the highlight for tomorrow. That ain't all we got to do. We got to do a lot more. Remember that root system and that ground in which those roots were feeding? Discrimination, poverty, lack of jobs. We got to go into something called social determinants of health. And this is why that survey that Women of Colors did was so important. Because if you listen to them, every last thing that they brought up reflected right here. And what the social determinants of health says through Center of Disease Control and Prevention and other public health agencies is that these 5 areas, these determinants, they show or cause the outcomes of either positive health outcomes or negative health outcomes, depending on one little thing. And that one little thing is called access. So if you've got access to health and quality health care, that's a positive towards your health marker. If you've got access to education and quality education, as was mentioned by here, the teachers need to be able to learn this and be able to perform that with their students, then that helps your health, your outcomes. If you've got a neighborhood and built environment that has access to sidewalks and parks and plenty of lighting and low crime, then that links to your positive health outcomes. If you've got a social community context where people feel bonded one with another, where there's no or little discrimination, then that links towards your positive health. And this is my favorite. If you've got economic stability and access to it, or you can pass down generational wealth, then that links to your positive health outcomes. And all I got to do is remove one word away, access, and that entire house crumbles. That entire community crumbles. The entire outcomes crumble. They're not stable. And what there then needs to happen is that we become the ones who end up holding institutions and systems accountable so that we can restructure those so that there's access for all. How many of y'all, that sounds like a good thing to do? Who would want to be a part of that with women of colors? I mean, taking that data and running with it towards those social determinants of health so that your children that you love and value highly can come out reaching the sky. If that's you, I want to thank you for helping make a collective impact, not only for what you're doing in your immediate community, but the potential for what we can do in our entire United States and beyond. Let's be that change maker that I know that we can be. Thank you so much, everyone. Thank you.